Hospitals hammered. The COVID surge relentless.
This one is ramping up to be bigger than that first surge that we've seen.
And this time around, it's affecting all ages. Dr. Brad Blaker with McLaren Bay Region says the youngest COVID patient he's seen was 6. It's been stressful.
Every day they're coming in and we're starting off with high patient volumes, and we're ending the day with high patient volumes. And so it does stress the team, but I will tell you they're holding together very well.
Also keeping their ER flowing, Covenant Healthcare.
For the last week or so, we seem to have kind of plateaued, and we're staying kind of at a similar number, as opposed to as you're going into a spike, it's climbing. We're not seeing that anymore.
But not far away, rural hospitals up north and in the Thumb are barely keeping their heads above water, often having to send patients to the Saginaw Bay area.
We're getting transfers in from Petoskey, from Sheboygan, Gladwin, the Thumb area, just all over the north.
But sometimes during these surges, ERs get crowded, and talks of ambulance diversion are starting to come up. That means incoming ambulances would be directed to other facilities.
Have you guys had to do any of the ambulance divergence?
We have had a little bit earlier, about a week or so. The ambulance in the community, we've always been open, but sometimes temporarily, some of the regional hospitals far from us, we had to temporarily say, no, we're not able to accept people outside of our region.
We haven't physically had to go on diversion yet. We have had to delay transfers. And so our ascending facility will call us up and say, hey, we have this really sick patient. We'll say, can you hold on to them for 4 or 5 hours until we get a little bit more caught up?
Both of these doctors say if you want to help your local hospitals and healthcare workers, get vaccinated. Scott Walczek, WNEM TV 5.